Today on the podcast, we're going to take a look at how healthcare impacts Vermonters and the work ahead of us this legislative session. I am so excited to have Representative Alyssa Black join us for the podcast today. Alyssa has 30 years of healthcare administration experience. She was first elected to the House in 2021 and has sat and served on the Healthcare Committee since that time. She is currently the chair of the committee and excited to have her on the show. Welcome, Alyssa. All right, Alyssa. So we're going to do a breakdown on the clock here. Last legislative session, we passed a prior authorization bill. Can you explain for our listeners what this bill does and how it helps Vermonters in under 2 minutes?
First of all, prior authorization is the mechanism that your insurance company uses to approve a ordered service that your medical provider has either ordered for you or prescribed for you. We did a lot of work in this bill putting guardrails, particularly around prescription medications, where just because the pharmacy benefit manager that your insurance company uses, they cannot switch your medications or require that you try and fail on medications that are cheaper for them, that the prior authorization that they're doing is actually based on real medical outcomes. That should have a major effect on providers being able to prescribe you effectively because your prescriber is the one who knows you, not the pharmacy benefit manager and not your insurance company, particularly when we talk about our healthcare system and what the legislature is doing and what the legislature can't do. We actually don't have the ability to mandate or create laws that affect a huge proportion of healthcare services. We have no ability to regulate anything in Medicare. We also have some say in what Medicaid can cover, but Medicaid has to receive waivers from the federal government, and so we have limited ability around Medicaid. And we also have no ability to regulate anything that's self-funded, and that is usually large employers that self-fund. And when you add up those three markets, you're talking about well over 60 to 70% of the insured population in the state. So we really do just a small slice. So the prior authorization bill will help that small slice.
Good job. What I remember from that debate on the House floor was the theme that this gives providers, healthcare providers, more time with their patients and less time doing paperwork.
Yeah, I think the numbers are somewhere for every 40 hours that a provider sees and is face to face with a patient, they spend up to 60 hours just doing administrative tasks. And it's documentation and doing things like prior authorizations, having to see patients back over and over again just to be able to get the treatment that they wanted in the first place. But they have to jump through all these hoops with the insurance company to get coverage for that patient. What the bill really does is it's targeting providers. Administrative burnout is the number one reason that providers cite for why they are leaving practice. And it is their biggest frustration. I worked in healthcare administration for 30 years. I have worked for hundreds of providers, physician's assistants, nurse practitioners, doctors. I have never met one provider who didn't want to just provide good care to their patients. And what this bill did is it really said, we trust providers to know what's best, to do what they're trained to do, and to take care of their patients.
That's great. I'm really proud of the work that your committee did last biennium on that bill, and I'm looking forward to seeing that working out in the healthcare field. So let's go to a big picture, right? Healthcare is a top priority on so many fronts. The cost of healthcare is going up. We're seeing providers, as you said, leaving. We have challenges within our hospital system. So, from where you're sitting, like, what is the landscape of our current healthcare system in Vermont? What is your take on it right now?
I will say we are in a crisis. We are in a affordability crisis. We are in an access crisis. We have entire segments of our healthcare system currently that are ready to collapse. It is, I'm sorry, it's frightening. It's frightening. We have hospitals that are risk of closure, and not just one hospital. We have our system of primary care is in peril because they're not reimbursed well. We have the care that people rely on to stay healthy it's just frankly in a crisis. We have insurance companies that are facing insolvency. It's a crisis.
So, what's our role in the legislature when it comes to healthcare?
So, I mentioned previously just about how small of a segment of the market we actually have any control over and regulations. But we do have in the state, we have the administration, the Agency of Human Services, Department of Vermont Health Access. We have the Green Mountain Care Board, which is a part of our state government, but it is an independent regulator. And there are some really smart people who are doing amazing work in all of these organizations. And I think that the thing that we as a legislature can best do to support that work, we want to make sure that they have all the tools that they need to effectively regulate, to transform, and we need also oversight in these organizations to ensure that they're administering and working towards the goals of creating a more accessible, affordable healthcare system in the state. And so I really think it's more about accountability and oversight, and also at the same time affording them the ability to do their job in the most effective way that they can.
So, we've heard a lot over the summer and fall around this Act 167 report. So, can you talk, Alyssa, about what the goal of hospital transformation is and how it fits into the broader healthcare reform picture?
Well, we set this in place. Act 167 was about 3 years ago, and it was with the goal of transforming our system of care. And, we talk all the time that the best way to have accessible, affordable healthcare system is to ensure that Vermonters have the right care at the right time in the right setting. And what Act 167 did was to lay a framework for ensuring that that happens in regards to hospitals and hospital sustainability. So for the first phase, which we have gone through, which was we had tasked the Green Mountain Care Board with doing a deep dive of listening to Vermonters. They spent well over a year going all over the state on tours, talking to providers, hospitals, just Vermonters. Every single county in this state had multiple community engagement meetings. It was finalized with a report, and the report had several recommendations in it in order to, again, that Vermonters are receiving the right care at the right time in the right setting, and how we can transform our system of hospital health care to ensure the financial viability of every single hospital. I mean, there are entire swaths of the state that have no primary care, no meaningful mental health care which can serve the population that they need. It's really about right-sizing the hospitals for the services that their communities need in that health service area, and ensuring that we have more tertiary care in other settings around the state. But it's really about maintaining the financial viability of the healthcare system for all Vermonters. Workforce has been a challenge. We have a shortage of nurses. And over the years, the legislature has appropriated large sums of money for scholarships, loan repayments. I often say, you think it's very simple of just do scholarships, but then you realize that there are not enough slots at schools that are training just for nurses, for instance. And then you realize it's because they can't find nurse educators because the salary ranges for nurse educators are less than what that nurse would be making if they were just practicing as a master's level RN. And also you realize that there's not, lab space at some of our universities. So it's about, trying to build up the facilities, the teaching, so that we can open up slots. We've had a lot of scholarships for primary care where, pay for medical education with a commitment to be able to practice in that state for a time. Unfortunately, we're up against every other state who's doing the same thing. And of course, we have a huge issue with workforce particularly in our designated agencies, our system of mental health care in our state, because, these are master's level positions and the pay is just not in line with other master level positions, and there's a shortage.
There's some good news out of Vermont State University of their most recent class having around 500 graduates in nursing and around 90% staying in Vermont, which is super exciting. And it's always great where we talk about concepts of how we can grow and support our workforce in Vermont and then actually hear the success of it. And, we have a lot more work to do around workforce, but it's nice to see that the trend is changing and that we're graduating more nurses here.
It is. And it's evidence to what we've put into education and into the state colleges that they've been able to actually open up more slots, train Vermonters for meaningful careers.
All right, so Alyssa, can you share with us what is one of your top goals for the healthcare committee this session?
Well, we have a few, but I will say that this past week, we've been working on increasing the monetary thresholds for our current certificate of need process. Essentially, a certificate of need is a healthcare facility, if they are going to build something or increase services, that they have to go through Green Mountain Care Board, our state's regulator, to see if there's a need for that. And in the past, it has actually stifled competition a bit, which goes into the affordability question. So we're doing work around raising the monetary thresholds that would trigger the need for a CON. And that may help so that people can invest in building and creating new practices, facilities that can be operated at a more affordable price for Vermonters.
Love it. Love it.
So we've been working on this bill for the last couple of weeks. It's my anticipation that we'll finish up testimony and have some committee discussion on where we want to set things. I'm hoping that next week, possibly we could have that voted out and move to the Senate, and then we'll work with our colleagues in the Senate to ensure that hopefully that gets over the finish line this year.
If folks want to follow the work of the committee on this bill, what's the bill number?
Bill number is H96.
Great, thanks. So, Alyssa, I remember the first time we ever met. We were in the State House cafeteria.
Yep.
You were with Rob, your husband then, and some other advocates. And that day, I've never forgotten that moment. There was something, a connection maybe that we had where your story and your advocacy just really made a strong impression on me. And I immediately wanted to be part. Well, I was part of what you were working on, but really to work together on a shared goal around suicide prevention. Do you remember that day?
I absolutely remember that day, and I remember meeting you. I could tell you what table we were sitting at in the cafeteria. I had come to the State House, and I will tell you, I met you that day. That is the first day I have ever stepped into the State House. And I lived first time I'd ever walked
Wow.
in the door. And I had lived in Montpelier way, way back, like when I first came to Vermont. I had never stepped in the door. I was working on trying to, in my naivete of how things work, I was advocating for a waiting period for the purchase of a firearm in the immediate wake of my son Andrew's death by suicide. And I was working with an advocate just because I personally had become so completely overwhelmed. One day at home, I just remember saying, I need somebody's help. And and they lined up a few meetings, and one of them was with the House Majority Leader. I didn't even know what the House Majority Leader was. And I met you, and we sat down in the cafeteria, and I remember me just telling you my story because that's all I had. I was a citizen advocate for a policy. And I remember telling you my story, and then I remember you told me a personal story, which I won't share on this. And, you're right, that sense of connection. I suspect that the connection might be because we come from a very similar area. So, maybe we picked up on each other's Buffalo accent a little bit.
What Buffalo accent?
Yeah, what Buffalo accent? For the record, it sounds like we always have a perpetual cold all the time. That's the hallmark of a good. That is the hallmark of a good Buffalo accent.
I get called out on it like maybe once a year. So that bill around suicide prevention took many years to get across the finish line. But we did, and you reported that bill.
I did.
And it's been in effect for a little bit.
It's been in effect since July of 2023. And there were several provisions in that bill, particularly things around safe storage and expanding extreme risk protection orders so that families could actually petition the court for a loved one. I will say that I will watch the dashboard on the Vermont Department of Health's suicide website, and they have month by month. And I know that there are still some death certificates that are still pending in the state for the year 2024. But the last I heard a couple weeks ago, the number of suicide deaths in the state was under 100. Mm-hmm. Just under 100. That would be the first time in, I think, 6 to 7 years where we would have less than 100. Now, I know better than anybody the importance of those 100 people, and those people meant the world to someone. But, I used to always say that, I didn't do this work. I actually didn't do this work for people like my son, to be honest with you. I did it for people like me. I just didn't ever want another mother. Or I wanted to do what I could possibly do to ensure that no other mother had to, sorry, but live my life and experience that. And so, watching those numbers, it really, really makes me feel a little bit better. It makes me feel like it's having an effect.
It is.
It is.
And that's powerful.
Yeah.
I can't imagine what that loss feels like. And I just remember driving home that night after we passed the bill and thinking about so many stories out there, thinking about, my favorite Rumble Strip episode about Finn and the Bell, just the impact that this bill's is having. It's having on families. And it's really powerful, and I really appreciate all your hard work on it.
Yeah, well, everybody has a story. Everybody's got a story.
I never met Andrew, but whenever I'm hiking at Colchester Pond, I think of him.
He would go out to Colchester Pond almost every day when he got off of work.
Wow.
Yeah. And he would take the dog with him. It's probably the last time the dog had a good walk.
Oh, gosh. Alyssa, you and I are hardcore Buffalo Bills fans.
We are.
And it was again.
Yes.
So close.
So close.
And, there's always next year, as we say. What I love is Vermont has a lot of Buffalo Bills fans.
I would say I had a breakthrough this year with my Bills fandom.
Really?
Yeah. So I've grew up right outside of Buffalo. There's so much pain affiliated with being a Bills fan. And I have a son who was born in Vermont, my son Steven, and he somehow decided he was going to take on his mom's love of the Bills. He's surrounded by all Patriots fans, and his dad was a Jets fan, but he's like, no, I'm going to go with my mom's Bills. And he's 31 now, and he recently had his own son.
Congratulations.
Best picture I ever got this entire year was my son in his Josh Allen jersey with my 6-month-old grandson in his little Josh Allen jersey, and the two of them, and just the big smiles on their faces. This was at the beginning of the season. But we had this thing of Benson is my grandson. Benson will never know a world where the Bills are not Super Bowl champions. That's what my son and I kept talking about all year long. And obviously the Bills lost to the Chiefs in the AFC playoffs. And my son called me, and I feel like I had to be the mom, and I was consoling him. I was like, our lives go on. I know it's painful. I know how hard it is. And he's like, but what about Benson? And then I started thinking about what my love of the Bills has given me. My love of the Bills has given me resiliency. It has given me the ability to stay true to something and love something even when you experience pain and disappointment. I love the Bills in every losing season and every winning season. And they have brought enormous joy to my life. And that's about a lot of things in your life. It's not all good. It's not all bad. Find the joy.
I love that, I would say. I agree, and it's taught me patience.
Yep.
And perseverance and community. And I love that. So Bills fans out there, we see you. We feel the pain, but next year's our year.
Yep, next year's the year.
So we have gotten a question about what's the Bills Mafia? What is that?
Yeah, which when I was growing up, there wasn't termed as the Bills Mafia.
No.
But Bills Mafia is just the dedicated fan base. And if you're from the city of Buffalo, you can really get this. It is a very blue-collar city, and, this is their pride. And they live and breathe the Bills.
It's amazing tailgating, right? And I will say that
Actually good chicken wings. Sorry.
for those of you who enjoy chicken wings, yes, great comfort food. And I love the pride and creativity with the jerseys and people's routines. So, like, I have 3 jerseys, but this season I just stuck to like my one old school favorite one. I felt like that was going to help somehow. So now I have to figure out if I'm going to wear that next year or if I'm like, I might have to change my plan up. But you also added to your Bills apparel this year.
I added to my Bills apparel last year, and then I added again, but I have to say, I don't know if this is going to sort of blow your theory of your new out of the water, but I wore every single game this year a Bills shirt that you gave to me. So,
That's right.
so did the Bills' winning season happen because I was wearing your hand-me-down that you gave up on? Or was it because you had a new one and you were wearing that? Who knows? Whose shirt is responsible?
Well, we may never know.
We may never know. I did get new Bills shoes this year, though.
They're really cute.
Yeah, they're
Very sparkly.
My sparkly sneakers.
Yes. Favorite play of the season? Do you have one?
I don't think I have a favorite play of the season. I mean, I have a favorite play, but it's used so frequently. I'm sorry, I can't not love the Josh Allen tush push.
I so knew you were going to say
I
that.
mean, come on. because it's effective. That's the only reason I love it.
Okay, but that can't be your only play call for every, like, 4th down conversion.
I don't know. It's Josh Allen's tush. It could be every play call.
Okay, well, I'm going to go with Damar Hamlin's interceptions. There was 2, but, like, that first one, oh, amazing.
It was the first one because it was after, and it was his first career interception, wasn't it? And then, of course, everything from last year with him.
Yes.
It was just, and the stadium just erupted.
It was wild.
It was wild.
As it should be.
Yes.
For that accomplishment
Yeah.
after his very, very scary health emergency last year, where his heart stopped beating on the field, and thankfully, they were able to get it back going, and it was the scariest thing.
It was.
And so relieved that he's just thriving now.
Thank you for reminding me of that play because I was just thinking about the tush push.
All right. Well, I think that's a wrap.
I got sidetracked.
Alyssa, this was great. Thank you so much for coming on the podcast. Really appreciate it.
Thanks for inviting me. Always thrilled to be invited.
I wanted to talk about healthcare on this podcast because it's so critical to Vermonters, our communities, and our economic stability in this state. And it's tied into so many other factors like housing, mental health, so many things. And so we'll continue to explore the ways that all of these issues are linked together. But I really appreciate taking a deeper dive in what we're doing on healthcare this session. But healthcare isn't the only thing that we are working on and talking about in the building. The Budget Adjustment Act is now in the Senate, and we have started work on the 2026 budget. Other very important critical work taking place is our work on public education and how we fund it. I've said time and time again that it is so important that we make sure our kids have the best education at a price that we can afford. We have many, many committees working to find solutions to this, ways to keep costs down, while also making sure that our kids can thrive. And that's happening in every corner of the state. So stay tuned. We'll soon be talking about education in a future podcast. Thank you for listening to the State of the House. If you enjoyed the conversation, please share it with your friends and leave us a review on your preferred platform. If you have requests for future guests or questions you'd like us to answer on the podcast, please send us an email to speaker@leg.state.vt.us. This episode was produced and edited by Molly Moore and hosted by me, Jill Krowinski. Until next time.